So we have looked at the senior citizens and social welfare related to that. Now we look at the children, how they have fared in Pakistan as far as social welfare or their welfare is concerned. So in Pakistan, children are more than 45% of the total population. So a huge cohort, a huge number. But they have been deprived of the most basic facilities. Human rights like right to survival, right to education, right to health, right to protection. And these rights are given not only in the 1973 Constitution, but also enshrined in many international agreements which government of Pakistan has signed many times over the years. Pakistan has one of the highest level of newborn deaths in the world. So these are some of the statistics which tell you that children in Pakistan are living in a very bad shape as far as their condition is concerned, and government is maybe doing something, but it's not enough. So Pakistan has the highest level of newborn deaths in the world. Polio, which strikes primarily children, is still endemic. Therefore, the last 2 or 3 years, the number of polio cases has decreased to single digits, 5, 7, 9, and it was hoped that in the next couple of years, polio will end. It's only two countries in the world that polio still exists. It's Afghanistan and Pakistan. But in 2019, the whole achievement have been reversed. There are now more than 200, around 300 polio cases have been discovered in 2019. So this is how children are faring in Pakistan and how polio is still affecting their lives of many of them. So there are estimated 7 million children who are out of school, who are not in school. So this shows that they are not going to have a middle class existence. It's very difficult for a child, for a person to have a middle class existence in Pakistan if they don't have even minimal education. Most of these children who are out of schools are girls. So there's a huge gender gap, 60% of them. Child labor is increasing. ILO estimates that there are 12 million child laborers in Pakistan, where they are abused, discriminated, tortured. So all these things are there. Child sexual abuse is increasing. You may have heard many cases that we see regularly in the media. There are more than 1 million children are married each year. Mostly they are girls. So even before 18, before they attain maturity, they are married. And this is one of the reasons why mortality and maternal mortality and infant mortality has not gone down as expected in Pakistan. Children are also at a higher risk of hunger and malnutrition in Pakistan. The National Nutrition Survey 2011 reveals that 15% of the under age 5 children are wasted, 43% are stunted, and 31% are underweight. So when you start with these kind of problems, of course, your mental development is impaired irreversibly. So you can't attain full mental development if you are malnourished or underweight. So what are the challenges? Why governments have failed to help children in spite of the fact that they have said they are going to help children and they care for the children and they love children and all that. So the fiscal constraints are there. So there is never enough money with government of Pakistan to spend on children. They are spending on loans, and they are spending on defense, and they are spending on civil administration. Then there are cultural practices and social mores. For example, early marriage is a problem. Then this idea that girls should not be educated is a cultural practice which slowly is going away, but still there. Poverty is another issue. So government cannot help all these people. If there is less poverty, children may fare better. Law and order, if there is insurgency in KP or Balochistan, of course, children will suffer, children will die, children will be injured because of law and order issues. Then corruption also in the government departments also doesn't help in improving the lot of the children. And then there's the tussle between the donors and governments. So governments have their own priorities and donors have their own priorities. So this tussle also lead to suffering or less money for the children benefit. Thank you.